Hello, I'm Dr. Jenny Andrus, and welcome to Joint Ventures, an OSC original podcast. Recently, a federal court in California said that nurses with doctorates do not have the right to call themselves doctor. The court found that the use of the title doctor by a non-physician in a clinical setting is inherently misleading. As more doctors' offices and hospitals use nurse practitioners and physician's assistants, how do you know what your provider's credentials are? What role do these different providers have in your care? And when is one type of provider needed over the other? Well, let's get into it. Doctor itself is a kind of generic term. You can be a doctor of just about anything: chemistry, philosophy, education. But when that intercom comes on a plane and they ask if there's a doctor on board, we all know that they are asking for a medical doctor. But what about within the medical community itself? A lot of providers have the title doctor. What's the difference? Well, at OSC alone, you might see 4 providers who all have doctor as their title, but it means something different. So you might see a doctor of physical therapy, or DPT. That provider typically did a 3-year training program after college. That doctor does not prescribe medicine or provide medical advice about colds or that kind of thing, but is an expert in therapeutic exercise, functional training, and the application of therapeutic modalities. There are some limited procedures like dry needling that a doctor of physical therapy might perform on you. You might also see a doctor of podiatric medicine, or DPM. That doctor went to a podiatric medical school after college, followed by a residency, providing more experience and specialization. A DPM provides medical care and performs surgery on the lower leg, foot, and ankle. That doctor can prescribe medicine, perform surgery, procedures, really the complete medical care, but is limited to the lower leg, foot, and ankle. You might also see a doctor of psychology. Now, in psychology, a doctor might have a PsyD or a PhD behind their name. While certainly there is some overlap, most PsyD professionals are clinical-based, while PhD may be more academic or research-based. While the time to completion varies, most psychologists complete 2 to 4 year program after college. Now, psychologists are specialists in mental health, and they perform therapies, particularly talk therapy, but they do not prescribe medications. All of these doctors require passing a board certification, obtaining a state license with continuing education requirements. Now, when it comes to the types of medical doctors, there are 2 types: MD, or medical doctor like myself, or DO, or doctor of osteopathic medicine. Both of these doctors did a 4-year medical school after college. Both did a residency and potentially a fellowship to specialize in a specific type of medicine. Typically, these residencies and fellowships are integrated, so MD and DO physicians train together typically. Both take the same boards, they have the same license. Now, DO training tends to have more of a holistic focus and uses physical manipulation as well. That's really the biggest difference nowadays, is that DO training includes the study of osteopathic manipulative medicine. Otherwise, they typically function about the same, or essentially the same. DO now is not the same as chiropractor. A doctor of chiropractic cannot prescribe medicine or do surgery and did not train in the full array of medical training done by an MD or DO. Now, here's where it's even going to get more complex when we start talking about physician's assistants and nurse practitioners. And that's why today I'm really excited that we have Becky, who is the nurse practitioner who works with myself, and Dr. Sureja. All right, Becky, tell our listeners a little bit about yourself.
Hey, everybody. My name is Becky Murdoch, and I am the new NP with the Pain Management Group here at OSC. And becoming a nurse practitioner can look different for many, but I'll kind of walk you through my journey to becoming a nurse practitioner, because I kind of started at the basic fundamental level, and then I stair-stepped my way up from there. I started my journey going to a 2-year community state college and obtained my associate's degree in nursing, which is truly your basic entry level into nursing practice at the bedside. And so, just for reference, once you complete the college requirements and get enough clinical hours, you can sit for that state board exam and become a licensed registered nurse, which allows you to then practice. So after I became a registered nurse, I began working and went back to school online to obtain the next step, which was the Bachelor's of Science in Nursing degree. I obtained that, continued working at the bedside, primarily in the ER. And then during that time, I kind of, while training new nurses, really found a love for teaching, and decided that I'd go back to school and obtain my master's of science in nursing. Again, all while working at the bedside. Once I obtained my master's degree, I left the bedside and began teaching nursing full time, but I did maintain my clinical skills by continuing to pick up shifts in the emergency room. While I loved teaching, I continued to have this feeling, this pull to kind of bring me back to the bedside and to patient care, which is truly what led me to go back to school again and become a nurse practitioner. And so since I already had my master's degree, I really just needed to complete what they call a postmaster certificate program and choose the specialty area, which is where I chose the adult gerontology acute care nurse practitioner. Once I completed the required coursework and the clinical hours, I was eligible to then sit for the national certification exam. So this stair-step approach that I took is actually the case for many nurse practitioners. We kind of start out at registered nurses at the bedside and continue to work while furthering our education all the way up to nurse practitioner. Basically, the whole time gaining those years of experience with patient care.
Okay, Becky, so there are a lot of types of nurse practitioners. So can you explain this a little bit to our listeners?
Yes, so there are some nurse practitioners that deal primarily with adults and geriatrics, so that's the AGNP, which can further be classified into acute care or primary care, and they can treat patients that are 13 years and older. There are some that deal only with pediatrics or children. That's your pediatric nurse practitioner. Then there's your family nurse practitioner, or FNP, and they can treat patients of all ages in the primary care setting. There are some that mainly deal with the psychiatric mental health, and that's the PMHNP, and there are a bunch of other specialties, but these are some of the most common ones that you'll see. So the difference is that there's acute care and primary care, and that has a lot to do with like the school that they have to do. So the nurse practitioner will get clinical hours in an acute care setting, such as your emergency room, your urgent cares, and in the hospital itself, or either some other specialty area in which they see patients with more critical illness. Whereas with primary care, they will see patients within an office setting and focus more on preventative care, such as vaccinations, medication management, health screenings, and just overall maintenance of health and chronic conditions.
So now people may also see a physician assistant, and that seems to function a similar role. Are there differences that they need to be aware of?
Yeah, they definitely function very similarly, but there are some slight differences. And so you heard about my and most NPs kind of stair-step approach to nurse practitioner. But for the physician assistants, kind of in a nutshell, because I'm not a PA, they go through about 24 plus months, depending on the program, of classes and clinical training, but they may not be working in patient care at that time. Whereas it's required for to be a registered nurse prior to becoming a nurse practitioner and actively working. But some of the biggest differences between NPs and PAs really comes down to the training focus and the practice structure. So nurse practitioners, like I said, are registered nurses first. Then they complete that graduate nurse practitioner training, such as a master's or a doctorate of nursing practice. But PAs are required to have some sort of patient care as well prior to enrolling, but the amount of hours may vary based on the program that they choose. Nurse practitioners choose a population specialty from the very beginning, which is all those acronyms that we talked about before, whereas PAs are educated under this medical generalist, which covers a wide range of medical areas. They do have the ability to obtain certifications of added qualifications in a specialized area once they meet those requirements and pass that special exam. NPs work more of the non-operative care areas and are usually found in primary care offices, but you will see those with acute care certifications in specialty areas such as orthopedics and pain management.
Of course.
PAs, again, are generalists covering a wide range of specialties, and they usually work in your more operative care, specialty, and surgical areas. So an example of how nurse practitioners must remain in a certain specialty area would be that a family nurse practitioner, FNP, cannot work in an ICU or critical unit without becoming an adult gerontology acute care NP first. So ultimately, the PA, though, however, can work with cardiology in the hospital one year and maybe orthopedics the next. So they have a little bit of leeway there. PAs work directly under the supervision of a physician, whereas NPs actually can practice independently in the state of Virginia, However, here at OSC, both PAs and NPs implement the treatment plans set forth by your physician. So with all this information, let's talk about when you go into your doctor's appointment and you are greeted by a physician assistant or a nurse practitioner instead of the medical doctor. What does it mean and how is it different? Well, again, here at OSC, being seen and evaluated by a nurse practitioner or a physician assistant does not mean that the medical doctor or physician you're used to seeing is not part of that medical decision making. The nurse practitioner or the physician assistant will talk to you. They will evaluate you, they will assess you, and they'll even ask clarifying questions to really get an understanding of what the true complaint or concern is. They will then take this information, present it to the physician, and then together as a team, they will come up with a treatment plan. So really, when you think about it, you're getting two medical providers instead of one. It creates this increased ability to see more patients in need in less time in a smoother fashion.
All of these different providers that we've talked about play a role in the continuum of care. At OSC, while the medical doctor is the head of the team, we have amazing advanced practice providers like nurse practitioners and physician assistants who help us implement that care. More hands and more eyes on you means you have more people keeping you on the right track to better joint health. I hope we've helped clear up the who's who and what all those letters behind the names mean. All those letters indicate people who spent a lot of years, a lot of time, and a lot of money in learning how to keep you moving. And we all have an important role to play. Please rate us and subscribe. If you have questions that you want covered, let us know in the comments. We're always working on new content for you. Wishing you good health and see you soon. Bye-bye.
At Orthopedic and Spine Center, we're dedicated to providing the highest quality treatment using the most advanced technology available. Our fellowship-trained spine and interventional pain management physicians specialize in diagnosing painful conditions and offer minimally invasive interventions to complex spine surgeries. Our pain psychologist helps patients understand and reduce stress from chronic pain conditions. Our experienced physicians get you back to doing what you love. Call today for an appointment. Experience excellence at Orthopedic and Spine Center.